Hi, my name is Nate Lawson. I'm the Director of Biomaterials at the UAB School of Dentistry. Today, my expert tip deals with a clinical problem that I've had some dentists tell me about. That is, after they have bonded some ceramic restorations in the anterior region, they have noticed some discoloration of the tooth structure underneath their ceramic restorations, which has led to an unpleasing aesthetic outcome. So many of us wonder, what is it that causes that discoloration of the tooth structure, and what can we do to prevent it? And if it does occur, what do we do to get rid of that discoloration? So we did some research in our laboratory recently, and what we discovered was that black discoloration of tooth can come from contaminating the tooth structure with a hemostatic agent that contained ferric sulfate, and then getting saliva on top of that tooth structure. So microleakage underneath a temporary crown. And when you put those two things together, the ferric sulfate in combination with saliva, you get this black precipitate on the tooth structure. So one way to avoid this potential clinical complication is to use a hemostatic agent like aluminum chloride, which will not produce this brown precipitate. If you do use ferric sulfate on the tooth, one way that we had found that you can clean the tooth afterwards to help prevent that discoloration is to clean it off with 2% chlorhexidine, or to clean it off with a 10% EDTA solution. Let's say you did contaminate the tooth structure and then you put on provisionals, and the day you go to bond the crowns on, you notice that black precipitate. What we found was the best way to get it off would be to sandblast that tooth structure with aluminum particles. You can remove this stain by using bleach, which is sodium hypochlorite, or hydrogen peroxide, but we found that stain can come back. So the best way to permanently remove it would be to sandblast it with aluminum particles. So I hope that clinical complication does not happen to you, but if it does, those were some strategies to deal with it, and that has been my expert tip. Thank you.